What do you want? Why do you want it? Now!
As a winter of industrial action looms, now a date is set for the biggest nurses' strike in 100 years.
You can repair a leak, or you can repair the whole roof, and the government's waited until the whole roof's going to go, and that's what's going to happen if they don't invest now.
Nurses like Mark walk out for 2 days in December.
I'm at the top of band 5. I get a bit of extra for living in London, but my take home is basically 30,000 a year plus that. It's not enough for the stress, the pressure we're under. We have people's lives in our hands. We're university trained. We have a massive amount of skills and knowledge, and the pay doesn't match that. We're regularly full by midday now. We have all our beds full, all our waiting spaces full, and there's still people queuing out the door, and we have to see them, and we have to provide care, and we're trying our best, but the stress is immense.
But there are strong feelings on both sides, and some, like Naomi, voted against strike action.
Cancer doesn't hold still for strike action, it still progresses, and a lot of these people need urgent treatment. And the whole purpose of a strike action is to make an impact. It doesn't, to me, seem like it's in the interest of patients, and I think, if anything, it's going to put fear amongst the general public, which is unnecessary. And again, it goes against the core values of being a nurse.
A record 7 million people are already on waiting lists in England. The union insists patient safety won't be compromised.
All right.
Piece of cake.
But as a new Prime Minister tries to grip a row over public sector pay, his message, there isn't enough money.
I have enormous respect and gratitude to our nurses, as everyone does, for the incredible job they do. And look, I know things are difficult right now for everyone because of what's happening with inflation. And that's why our plans that we outlined last week will get a grip of inflation and bring it down. That's really important. And in the meantime, what the unions are asking for, I think, is a 19% pay rise. And I think most people watching will recognise that that's obviously unaffordable.
It's possible strikes could be staggered. Whatever happens, industrial action will compound the NHS backlog. It's hard to see a deal being reached. The two sides are miles apart, and where the Tories ordinarily wouldn't shy away from a fight with the unions, and we know that they have directed more money towards the NHS in the autumn statement, a row over nurses' pay is uncomfortable for a government that wants to be seen to be on the side of the NHS. It's a moment of political danger for the PM. Mark says nurses have limited leverage, and it's not a decision anyone is taking lightly. Ali Fortescue, Sky News.